download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. Supporting the centre's decision to order fresh mock drills in hospitals across the country to test their COVID preparedness and amid rising cases, former director of AIIMS New Delhi, Dr. Randeep Guleria on Thursday said the drills would be a timely test of the prevailing healthcare infrastructure and keep people in the loop about an outbreak. Dr. Guleria, who is currently the chairman of Institute of Internal Medicine, Respiratory and Sleep Medicine, Director Medical Education Medanta, he also said that it is always better to be ready. Preparations should be complete, so I believe that mock drills are always good because we test the system if there is an outbreak or surge in cases. With an aim to improve and upgrade the medical education sector in Jammu and Kashmir, the NMC has decided to approve 100 MBBS seats each in two medical colleges, namely Government Medical College Handwara and JMC Udhampur. A letter of intent has been issued by the NMC for 100 medical seats each at these two medical colleges in the state. Therefore, this is a major reason for the medical aspirants in the state to celebrate. A smart bandage that can monitor chronic wounds and help them to heal has been developed by scientists who say the device could aid people with diabetic ulcers, burns and non-healing surgical wounds. According to figures from 2018, there are 2.2 million people in the UK with chronic wounds costing the NHS €5.3 billion a year. Now researchers say that they have come up with a device that could help such wounds to heal, a stretchable wireless bioelectronic system that can stick to the skin. Dr. V. Gao, a co-author of research from the California Institute of Technology, said the device consists of two parts, one reusable flexible printed circuit board and one disposable patch. The disposable patch contains biosensors, electrodes and drug-loaded hydrogels. The biosensors, being the smart bandage device, can monitor features of the wound such as its temperature, pH and levels of substances including glucose, uric acid and lactate, metrics that provide important insights into whether the wound is infected and its levels of inflammation. Observing that the doctor did not attend to the patient immediately when she was in severe labor pains, but the patient was left in the hands of assistants who were neither qualified nor trained, Epic's Consumer Court bench recently upheld the District and State Consumer Commission's order holding the doctor guilty of negligence for the delay in performing the Caesarean delivery. The NCDRC has dismissed the revision petition of a UP-based doctor who was directed to pay ₹3 lakh to the complainant after being held negligent by District Forum. Many people who have dieted are familiar with the yo-yo effect. After the diet, the kilos are quickly put back on. Researchers from the Max Planck Institute for Metabolism Research and Harvard Medical School have now shown in mice that communication in the brain changes during a diet. The nerve cells that mediate the feeling of hunger receive stronger signals so that the mice eat significantly more after the diet and gain weight more quickly. In the long term, these findings could help developing drugs to prevent this amplification and help to maintain a reduced body weight after dieting. Women with mental illness, neuropsychiatric disability or substance abuse are less likely to go for gynecological smear tests for cervical cancer and run more than twice the risk of developing the disease. The findings are presented in the Lancet Public Health by researchers from Karolinska Institute who stress the importance of proactively approaching these women as a preventive measure against cervical cancer. In May 2020, the WHO approved a global strategy for eliminating cervical cancer as a women's health problem. Part of the strategy is a requirement that 70% of women are screened for the disease at least once before age 35 and twice before age 45. Using artificial intelligence, researchers have discovered how to screen for genetic mutations in cancerous brain tumors in under 90 seconds and possibly streamline the diagnosis and treatment of gliomas, a study suggests. Molecular classification is increasingly central to the diagnosis and treatment of gliomas as the benefits and risk of surgery vary among brain tumor patients depending on their genetic makeup. In fact, patients with a specific type of diffuse glioma called astrocytomas can gain an average of 5 years with complete tumor removal compared to other diffuse glioma subtypes. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.